I am getting the chance to pick the brains of two very talented doctors today about the health of our mouth and ask all the questions we can. Welcome, Dr. Edward Cole and Dr. Susan Sharp. You guys, thank you so much for joining me, allowing me to pick your brains.
Tina. Good morning.
Good morning. So let's start right in. Let's start with gum disease. Kind of tell me what that is.
Well, in our practice, Dr. Cole and I, that's what we do as periodontists. We treat periodontal disease, and it's a very wide range of disease, starting from early to a very advanced. So the patients come in and they may have bleeding gums, they complain of bad breath, and to the point where their teeth, they've lost so much bone, supporting bone, that their teeth are loose and may have to be removed. And we work hard to try to have patients keep their teeth, and that's what we promote. But in the end, if their teeth need to be removed, that's how maybe a set of new teeth, the all-on-4 concept, may benefit that patient.
And I know we're going to be diving into some of these treatments and answers to this.
Yes.
But you know, there was a phrase that I've heard that I don't really know what it is, and I'm hoping again to pick your brain and get. What is a dentally exhausted patient? What does that phrase mean?
Well, when a patient comes to our office, they're dentally exhausted. What it means is they've had years of treatment, they've spent a lot of money, they've had multiple extractions, they've had crowns, they've had root canals, and their problems are still not addressed, and their treatment is never completed. And so they're exhausted from years of treatment, and so the all-on-4 concept may be a permanent solution to all the problems where they leave our office with a new set of teeth, healthy teeth, and a new smile.
I know someone out there is watching saying, that's me, I'm feeling that exhaustion.
Yes.
And I know like we said, we're going to be talking about these treatments, implants being one of those. Who is a good candidate for implants?
You know, anybody that meets the age indications, meaning you have to have had adult teeth in your mouth and you have to be of age to be able to do this, is a candidate. Anybody that can walk through our door health-wise is a candidate for implants. We all have different things going on in our mouths, and so each individual has a different treatment plan for what we do, whether we do one implant or whether we do multiple implants or we do the all-on-4 treatment, depends on each individual patient.
Now these implants, is this something that maybe could really change for people that wear dentures and could be an answer to that?
Denture candidates, denture wearers are the prime candidates because dentures don't fit.
Yeah.
You're exactly right, Tina. And people that are dentally exhausted by having these ill-fitting dentures, they would like to have something that fits instead of using that poly grip and all that other things that they use. So we have a way of attaching this fixed prosthesis to implants. And
is this something that is like a long process, or could I come in one day and my life be changed like that?
Your life can be changed in one day.
Wow.
You come in and we can place the implants one day and secure your permanent prosthesis to those implants, and you walk out with a smile that is fixed. It is no longer removable in your mouth.
That's amazing. And really, when we say life-changing, it is really life-changing for a lot of people. And I know we've hit on this all-on-4 concept. Kind of, let's dive deeper into that.
So it literally transforms a patient's life because they've lived in shame, they cover their mouth when they smile, they're not able to eat, and they come in one day and they have their teeth, their failing teeth removed. We have a laboratory on site with us, and the implants are placed, and they leave with their new smile, their new set of teeth, and they feel that their life has been transformed. They're confident, they can go out into their community, talk with their friends, go out to dinner with their family without being embarrassed and feeling shamed of how they look and how they feel.
Doctor, can I tell you these before and afters that we're looking? Amazing. These smiles, even the smile, I would like to say they kind of have a different confidence to them.
You know, our implant company that we do implants with did a study in 2009. They interviewed about 60,000 people, and they found out that people, #1 complaint is their smile out of 60,000 people. So it's kind of indication of these pictures that show how much they smile and how much they have changed their life.
Wow, these were beautiful. Thank you for bringing these
Yes,
before and
they're
afters.
amazing.
It's so much better to see it with your own two eyes. And I try to think of all of the questions in the world to ask you guys, but I know I can't think of everything. What are some of the common questions you guys hear just day to day?
I think one of the main things that we deal with is the patients want to know how much pain is going to be involved. And it's amazing when we do this procedure all in one day. We sedate our patients so they're very relaxed, and the procedure goes very smooth. They think it was not that much time. They leave and they have their new smile. We see them the next day, and it's amazing how little bruising, swelling, and pain they have. So that's a main question.
The other questions that I hear a lot is, are they a candidate for this
Yeah.
procedure? And pretty much everyone, 7 out of 10 people are candidates for these procedures, whether it's a single implant or an all-on-4 treatment. And the other question is cost. People are very worried about cost and how they pay for something like this. And we have numerous ways for people to pay for this. It is actually not as costly as having bridges and permanent teeth done. This is a different concept because it makes it affordable for people.
Well, and the best way to get all of these answers is to get a hold of you guys, and I'm going to let everyone know how they can do that. But doctors, again, thank you for letting me pick your brain.
Thank you
Thank you
so
so
much for
much.
having us.
You have been wonderful. Now, all of their locations are listed now on your screen, so take a look. There's one near you. For even more information about achieving a beautiful smile like we saw earlier with Southern Arizona Periodontics, just call 200-2272 or visit sazperio.com.